What are the risk factors for osteoporosis fractures? When we talk about osteoporosis fractures, we refer to fragility fractures that occur from low-energy trauma. These are injuries that would not typically break healthy bone. Understanding the risk factors for these fractures is crucial for effective fracture risk assessment and management. One of the most significant risk factors is age. As we grow older, our bone quality tends to decline, and the likelihood of falls increases. Even if two individuals have the same bone mineral density, older adults are at a higher risk for fractures due to changes in bone structure and increased fall risk. Another critical factor is bone mineral density itself. Low bone mineral density is a strong indicator of fracture risk. However, if someone has had a previous fragility fracture, their risk for future fractures rises significantly, regardless of their current bone mineral density. Fractures of the hip, spine, wrist, and humerus are particularly concerning, as multiple vertebral fractures can greatly increase the risk of new fractures. Family history also plays a role. If a parent experienced a hip fracture before the age of 80, this can independently increase fracture risk. A family history of severe osteoporosis or fractures adds to the risk beyond what bone mineral density alone indicates. Body weight and nutrition are important too. Individuals with low body weight or a low body mass index are at a higher risk for fractures. Additionally, inadequate calcium intake, defined as less than 1,200 milligrams per day, can weaken bones and contribute to fracture risk. Lifestyle factors should not be overlooked. Smoking is known to increase fracture risk independently of bone mineral density. Excessive alcohol consumption, defined as 3 or more units per day, also raises fracture risk in proportion to the amount consumed. Moreover, physical inactivity and an unsafe home environment can increase the risk of falls. Certain medical conditions and medications can elevate fracture risk as well. Long-term use of systemic glucocorticoids, commonly known as steroids, is a significant risk factor. Conditions like rheumatoid arthritis can increase fracture risk independently of bone mineral density and steroid use. Other medical issues that may lead to falls include vision impairment, neuromuscular disorders such as stroke or Parkinson's disease, dementia, and orthostatic hypotension. Chronic illnesses, including diabetes treated with insulin, may also contribute to increased risk. Gender and menopausal status are additional factors. Women, particularly those who are postmenopausal, face a higher fracture risk due to estrogen deficiency, which accelerates bone loss. Premenopausal women who experience amenorrhea lasting more than 6 months are also at risk. Ethnicity and race can influence fracture risk as well. Research shows that fracture rates vary among different racial and ethnic groups. For example, white populations tend to have higher fracture rates compared to Asian, Black, and Hispanic populations. This disparity may not be fully explained by differences in bone mineral density alone, as social, environmental, and clinical factors likely play a role. In practice, healthcare providers assess fracture risk by combining clinical risk factors with bone density testing. Tools like the Fracture Risk Assessment Tool, often referred to as FRAX, help estimate an individual's 10-year fracture probability. This information is vital for guiding decisions on screening and treatment. In summary, the risk factors for osteoporosis fractures include older age, previous fractures, family history, low body weight, smoking, alcohol use, certain medical conditions and medications, and factors that increase the risk of falls. Recognizing these factors is essential for effective fracture risk assessment and management, ultimately helping to prevent fractures and their complications. Always consult with healthcare professionals for personalized advice and management strategies.